thank you all for being with us. And I don't have an update this morning, so I'm going to be really brief. Just want to say thank you to all our residents in Snohomish County for your patience and understanding and doing a really good job of just socially distancing and being safe. We have quite a few people out in our parks and getting out and getting some of the fresh air and enjoying the weather we've been having. So I just wanted to say thank you, but I will be here for questions at the end of the session. So I'll just turn it over to Dr. Spitters.
Thank you very much, Executive Summers, and good morning, everyone. And I'm going to try something new today. We're going to talk a little bit about some data as it relates to COVID-19 and social distancing and such. So I'm going to try to see if we can get that up. Are you seeing a screen with slides?
Yes.
Okay, great. Is it full screen? Excuse me, I just need to check. You see the full screen filled with? Okay, thank you, executives. So, the first slide I want to show you is, you can see that it's going from left to right. It's time from mid-January up through the present, and each of those green bars represents the number of cases we had reported on that date. So that's not the date they got tested or the day the patient became ill, but it's the day the positive test result came to us from the laboratory. And then we start the investigation, as we've discussed before, to isolate the individual and notify their contacts. And you can see that through most of March, we were ascending and kind of flattened out sometime in late March. And then things, you know, there's some variability day to day, as you can see, but then things gradually started coming down through early April into mid-April. And overall, though, over the past 2 to 3 weeks, although there's a great amount of variability day to day, the curve has flattened in a way that, you know, when things are going up and the curve flattens, that's good news. And so that's what we saw about a month ago. But now that things have been coming down somewhat, you know, much down from the peak, we're starting to flatten out in a way that, you know, we really wanted to keep going down and hope to get the total numbers of cases reported every day down into a smaller group that bodes better for success as we unlayer our social distancing efforts, and it makes the contact investigation efforts more doable and more likely to be successful. Another look at similar data on this next slide with the blue bars. Instead of this being the day of report, this is the day that, in retrospect, when we do speak with the case and we ask, well, when did you first become ill? And so this is a little bit better measure, and you can see there's a little bit less variability in this. It's a little better measure of what's happening at any moment in time. The one thing is you need to discount the very low numbers in the most recent week because we haven't had all those cases reported yet. So we those last 7 to 10 days are sort of underpopulated. We haven't completed those yet. So again, overall though, if you subtract out the most recent week and then you look at last week, the week before, and the week before that, it's really hard to see a further decline akin to what we saw in April. So the message from these two slides is that it appears that now we're in, there was a good flattening of the curve about a month ago when the increase in cases leveled off. But now, after about a month of sustained declines, then we've sort of flattened out in the latter part of April and early May. So that's one potential concern. And that, mirroring that, the modeling group with the Institute for Disease Modeling at the University, or affiliated with the University of Washington, has looked at case report data and has estimated, you'll recall this reproductive rate, or R, which is, it's a mathematical figure that indicates the number of new infections created by every existing infection on average across the whole population over time. And so you'll recall that back when things were really coming in fast and a lot of people hospitalized and a lot of new cases being reported, every new case was leading up to about 3 new cases. And so we had that exponential growth where things were going up and the hospitals were getting full. The schools stopped. We kind of, went into the stay home, stay safe approach. And as you follow that curve, the purple one for Western Washington and the red one for Eastern Washington, in both settings, we saw the reproductive rate of the infection decline. And in Western Washington, it got well below 1. And getting below 1's good, because if R equals 1, then there's 1 new infection for every existing one, and we remain flat. If R is greater than 1, we get more cases. And so R less than 1 is what we want to see, a decrease in cases. And we had that going into April, but as you can see in the latter part of April, it's come back up and really is close to or at about 1. So we had been doing a little bit better in terms of decreasing transmission. Now we're back up to 1. And just to correlate that as really a validation, this slide looks at traffic mobility in 2020 on a given date between March 1 and May 1 compared to the same date in 2019. And the dark green bar is Spokane County. The orange bar is King County. We don't have Snohomish County data on this, but the trend seems to hold up, on both sides of the state, that we had a good decline with the stay home, stay safe efforts in March. And then we've seen a gradual increase in mobility over time through the month of April and on into early May. So we've got plateauing declines in cases, sort of increased movement, and that just raises concern for ongoing transmission and possibly returning to greater levels of transmission, which would not only lead to more severe cases and hospitalizations, but also deaths. And of course, one of the main things we're trying to avoid is overwhelming the medical care system with just too many people who are sick enough to need to be hospitalized. So when we go back to this reproductive rate, I do want to, these recommendations we come up with, we didn't just pull them out of the sky. There's an idea behind them, and I just want to break this down for you, that reproductive rate, that number of new infections that each existing infection on average creates, is the product of 3 things: the number of contacts the infected person has while they're infectious, the risk of transmission to another person per encounter, per interaction with them, and then the duration that they're contagious. It's really those 3 factors that drive the whole thing. And so when we look at what is it that we're doing to try to intervene here, our interventions are aimed specifically at these factors. So when we look at the number of contacts, and remembering that people can be contagious without knowing they're sick. Even if they do become sick, the first day or 2 of contagiousness is usually without any symptoms, and then the illness develops. So there's a day or 2 of transmission before I recognize illness. And for some people, they don't get symptoms at all. That might be up to 20–25% of cases, and so they can spread for several days not knowing that they're contagious. So hence the stay home, stay safe order, and the notion about when you do have to go out, staying 6 feet away from others, that reduces the number of people you have contact with. And then and that's for everyone, so that we're covering the people who are contagious and don't know that they can spread it. And then isolation and quarantine, isolation for the people who we know they're infected, and quarantine for people who are at high risk because they've been exposed to a known case. And again, if they do develop the infection during the first couple of days of being contagious, they won't even know. So that's why we quarantine people. But the thing that's really in people's control in this column, in the number of contacts, is When it's not necessary to go out, please stay home. If you're not an essential worker or your zone, your sector of the economy has not been opened for activity, we really ask you to stay home and only make essential trips. And when you do go out, stay 6 feet away from people. Now moving into the next column, if I do have to be in contact with other people, how can I reduce the chance that I might spread it to someone else unknowingly? And so that's where cloth face coverings come in. Cloth face coverings don't do so well in terms of protecting me against others. There's some protection, but it's probably, 25% better than nothing when comparing to like an N95 mask, which would be 100%. So wearing the cloth face covering is really about the benefit of others. It's about protecting others. And we don't want people using medical grade masks for this. This is really covering up what we might cough, sneeze, or breathe or speak out that goes into the air and lands on things and that other people can breathe in. It's about protecting others. Hand hygiene, not touching our faces, cleaning high-touch surfaces often, that helps both us and others to keep the environment clean, the things we touch clean, and if we are contaminating things, cleaning them periodically. And then those who work in healthcare and other sectors that come face to face with patients or clients, then they have personal protective equipment with medical grade masks, goggles, gowns, gloves, etc. Now in the future, there might be a possibility of, if there's a medication that treats COVID-19 effectively, then it might be something that could be given post-exposure to protect people while they're still incubating the infection, or even a vaccine or antibody preparation that we use, like say for measles, we give vaccine after exposure or that sort of thing, or immune globulin to people who have been exposed to hepatitis A. But right now we don't have any such intervention. There are studies going on looking at post-exposure prophylaxis in close contacts, but we don't have any information on which to act at this time. So we're really stuck with those kind of traditional methods, and I want to focus on staying home, staying 6 feet away from people when you do go out, and cloth face coverings. Because the last column, the duration of infectiousness, where we have some intervention that reduces the amount of time someone is contagious, that's out of our control right now. And that's why we're so dependent on self-isolation, self-quarantine, and these other matters, because there's nothing we can give anyone right now that we know that will shorten their duration of infectiousness. Certainly in the future, our hope is that there is a curative treatment that not only prevents people from developing severe illness or dying, but also will shorten the amount of time that they can transmit to others. And in some cases, vaccines can be helpful after illness gets involved. After someone gets ill, there's a vaccine, but that's usually, vaccine is more about preventing the acquisition of infection, not making it better. And then, of course, as time passes, more and more people will have acquired immunity, and may, even a year from now, if they got reinfected, if they do get reinfected, maybe their immune system will respond quicker and make them infectious for a shorter period of time. But this is really my plea to all of us to, this is a long haul we're in. We've done, as Executive Summers has said, we've done a lot of great work flattening the curve at the front end, bringing it down, but we're at a pause here as our world begins to look toward opening. That is a moment of caution, that the decline in cases appears to have plateaued. I didn't mention yet, but hospitalizations at a couple of our acute care facilities are gradually creeping up over the last couple weeks. And so that's of concern. And then the traffic movement increasing and generally being correlated with that reproductive rate of the infection. And so in a way, if you think of it, every trip we make out of the home, we're sort of adding a chip, if you will, to the risk of transmission by increasing our contacts. And so it really calls upon us to limit our outings to those that are essential, or if our employment is in a permitted sector now, toward our employment, and then getting right back home and then observing those social distancing, cloth face covering, and hygiene measures when we do that. And but that's my plea, you know, that the opening of sectors of the economy is not a green light for us to all just kind of let go of social distancing and the other aspects of stay home, stay healthy. It's all still in effect, and I hope that this walk that we've taken through how it contributes to the reproductive rate of the infection gives you something to hang your hat on as you think about this and try to struggle through both the economic and the social impacts of what we're asking you to do, which is no small task. I acknowledge that, but we really do need your sustained, disciplined help in keeping this going forward, because these are the only tools in our hands to try to limit the spread of disease and the hospital surge that could occur and that we're trying to prevent, while we at the same time try to reopen our world a little bit and get the economy going again. So with that, thank you for listening, and I'll turn it over to Dr. Schoenfeld.
Dr. Spitters, you need to reduce or get us back to the same page.
Right. Thank you for the reminder.
Thank you.
Good morning, everybody. It's a pleasure being here this morning, and it just so happens that May happens to be Mental Health Awareness Month. So it's fortuitous that I'm talking this morning. So this is really a challenging time for our mental health, and I think probably everyone knows that this has been a very difficult time for all of us. Human beings like predictability. We really, when there's a red light, we want everyone to stop at the red light. When there's a green light, we want everyone to go. We're very much used to having a lot of predictability in our lives. We like some novelty, but not too much. And so the lack of predictability that we have right now is stressing many of us out. There's a fear of getting sick, a fear of a loved one getting sick, a fear of a global financial meltdown, a fear of uncertain future, and our brains are not really designed well for sustained stress. And what happens is we end up having heightened levels of anxiety, heightened levels of tension, heightened levels of cortisol that courses through our body, and it creates a lot of tension, and it interferes with our ability to be the adults and children that we hope to be. Plus, we're also coping with just the challenges for many parents of homeschooling. That's been very difficult for a lot of parents, and just uncertainty about what's going to happen in the future. And this can really influence our mental health. It can result in increased anxiety levels, which has already been very high in our community and in our society, as well as increased depression for individuals that are likely to get that. So it's really important that we take care of ourselves. This is a time where we really need to use all of the coping skills that we have. We need to exercise on a regular basis. We need to find ways of relaxing. We need to make sure that we have good nutrition. And we really need to make sure that we limit alcohol consumption. When families are stuck together for days on end and people are drinking excessively, it's going to result in behavior that we don't really want to see. Sleep is really important. One of the things that I would encourage people to do is to limit screens for at least an hour before going to bed. Turn off your screen so that your brain can relax and help you get ready for sleep. Limit exposure to television news. I learned that if I'm feeling really calm and my heart rate's down and I want to get my heart rate up, all I have to do is turn on the television news and my heart will start pounding and beating faster. So it's important to get some news, but it's important not to be, to limit that to a reasonable amount. Make sure to get the facts, from the CDC, from the Washington State Department of Health sites, from Snohomish County Public Health Department. Getting facts is really, really helpful. And it's important just to understand that we're going to have, and we're going to experience more anxiety. We're going to have increased irritability, emotional meltdowns, fatigue. really in the 1950s, Hans Selye talked about sustained stress, which is what we are undergoing. And he developed a theory called the general adaptation syndrome. And what he indicated was that people first go through the alarm state, which many of us have experienced, and then we try to really resist that alarm state, and we try to cope, and we try to adapt. And that's the really great things about all of us, is that we have tremendous adaptability. And then very often, if the stress continues, we start to feel exhausted. And I think probably most of us can acknowledge that from time to time, we have more fatigue than we usually have. And this is just our bodies responding to this sustained stress. So it's important, if you find yourself reaching that point where you really need to talk to somebody to get help. For example, at the Everett Clinic, which is part of Optum, we're doing video visits, and this has become a new way of communicating with patients. But contact your primary care provider for a referral. Don't feel like keeping everything inside is really the best way of going. So it's important for us to really take care of ourselves, to take care of each other, and to really make sure that we are doing some of the things that we know are going to help us get through this. So, questions?
Thank you, Doctor. We have one question that's been submitted asking if the Snohomish Health District has any plans to issue a directive to wear face coverings, as King County did yesterday. Dr. Spitters.
Well, as I've mentioned, I think we do place a high value on use of face masks in public, especially in indoor settings and/or when you can't really guarantee that you're going to be able to maintain 6 feet of distance between you and others at all times when outside the home. And I think that's a should, not gee, it would be a good idea. We really want everyone to do this. To this point, whether we order it or make it a directive or just plead to your sensibilities to make this a community norm, I'm hoping for the same outcome. So at the current time, we have no formal legal public process in mind to codify, if you will, what I would like to see is an evolving social norm to use face coverings when out of the home. So that's our current message. It's at the current time it's voluntary in the sense that there's not an enforcement body making sure this occurs, but I do think it's an expectation that the health district is trying to lay out and socialize with the community, and hope that it's adopted. If we are getting down the road and seeing ongoing transmission and noticing that folks aren't wearing face coverings in public settings, then that might be a consideration at that point. It's just my hope that we can just all do this. It's also worth it to keep in mind that there are some people who cannot wear one, either because of medical conditions they have where they can't tolerate the mask, little children where it's a safety issue. But by and large, most of us, young and old, can and should wear cloth face coverings when we're out of the home.
So I'll just add, we became aware about 2 weeks ago that Seattle was considering a directive on face masks. And then last week, the King County was working with Seattle on that. We took a look at that draft directive, discussed it with the health district and our other partners, and believe at this time we're urging people to take precautions. Many stores are requiring it. We do see many masks out in our parks and on the streets. So we encourage people that can do that to do that at this time.